In this video, I want to talk about one of my favourite tests that I use when I'm working with people who might be suffering with some sort of hip pain, because it allows me to hone in on perhaps particularly problematic areas. So I'm going to explain how you can do this at home to check out how your hips are doing, and then you can make any adaptive plans that you need to in order to make your hips fully functional, fully mobile, fully strong, and fully ready to hit your health and well-being goals. So let's dive straight into this test. But if you are new to our channel, thanks for joining us. My name's John. I'm the head therapist, sports injury therapist, and practice owner, John W. Sports Injury. I want to do 3 simple things for you at this channel. Help you understand your body, strive forward to hit your health and well-being goals, getting rid of any pain and weakness along the way. So in this test, what I want to be doing is highlighting if you're somebody who suffers with general pain around the hip as to somewhere that could be a cause to that. Now, we call this test, it's sometimes called a Patrick's test, or I also hear it pronounced Faber's or Faber's. But I always like the name Faber's because it allows us to remember exactly what's happening in this test. But we can also call it the Figure 4 test. So what we look to do with this test, and I'm going to show you some live information on here, and you can see my restriction and my weakness. Now, what we look to do is we look to bring one leg up and place the foot onto the thigh, because the movements that we want to happen at the hip are flexion, abduction. So when we flex the hip, we abduct by bringing it away from our midline, and then we externally rotate the foot. So flex, the F of flexion, AB of abduction, and the ER for external rotation gives us Faber. And then from this position, what I want to do is drive my knee down as much as I can, and we're aiming to get that knee nice and flat, as you can see happens here. So that would be a nice positive result about the mobility and the general feel of my right hip joint. Watch what happens on the left hand side. So I go into that position, there's my flexion, there's my abduction as the hip comes away from the midline, and then I get my external rotation. Now, if I drive that down as far as I can go, boom, what do I get here? Well, a whole multitude of sins. You can see that difference. That leg isn't really going to work, that one. And that starts to tell me. Now, the big thing that I feel here is a pain kicking in my groin area, up into my hip flexor. So that's an indicator for me of a problem that I might want to start addressing. Interestingly, I also feel a pain at my outside lateral ankle. So perhaps these two things are starting to be linked. But with this test, I often see people get a pressure, a pain coming in the glute area, in the hip joint, its area, feeling very bony. So what this test allows me to do is really firstly get an objective measure, comparing one side, see that ease of how that drops. And then when I change and I do the same thing, I mean, again, I ask patients not to look, so they're not biased, but they tell me, yep, that's my furthest point. Then we can see that difference. The pain kicks in the top of my groin, hip flexor area. So I can really look to hone in on that as we try to develop that area. And then what we look to do as we create an appropriate program is therefore then retest and see if those measures or those measurements at the test are coming much closer. Try it at home. See how you find it. See how your left hip compares to your right hip, and also see where the restriction comes on the side that's more limited. It's a really interesting one, understanding quick wins and how you can address those to get more hip mobility. But as I said, this is something that gives you an at-home indicator. But if you find a restriction, if you find an issue, if you find that one side isn't as good as the other, I would strongly suggest that you get that checked out, so that then somebody can be finding what the appropriate rehabilitation program and the correct treatment methods in order to fully restore that hip. But has that been helpful for you? Have you made it all the way through this video and you're now about to try that test? If so, do me a favor and hit that thumbs up button, because that's going to show others that this is the type of content that they want to be seeing as well. And if you are new to our channel and you haven't subscribed, why not do me a favor and hit that subscribe button? It helps me out more than you realize. And also, I will then be able to let you know as soon as I drop on my next video to help you on your way to achieving your health and well-being goals whilst getting rid of pain and weakness, and hopefully learning something about your body on the way. See you on the next video.